More breaking updates coming in, and this time from the island nation of Sri Lanka, where the situation continues to remain tense. In fact, public anger is on the boil as protesters were seen breaking barricades outside Prime Minister's official residence in Colombo. So now the people have marched and reached the Prime Minister's residence, even broken barricades. You can see the visuals. These are late-night visuals from Colombo. And this is the angst of the people that's actually coming to pour out on the streets as they are looking for some answers because of the kind of economic turmoil that Sri Lanka is witnessing. Of course, it's the people who are suffering the most.
So during the course of this week, there have been the parliament session is going on, and the Rajpakshas have decided that they are not going to step down from their position, and the message has already been given by the cabinet ministers. Over the period of last few days, we saw that all those important portfolios ministers were told to resign. In fact, the son of Mahinda Rajapaksa, Nimble Rajapaksa, also stepped down from his position. But the government is making one thing very clear, that it is very easy for cabinet ministers to resign, but what is the process to bring back the economy at its own pace is a very important thing. On the other side, the opposition has also been protesting in outside the parliament, and they have been showing their anger against the present economic condition, which is also being followed by the public sentiment, because yesterday also we saw that there was protests outside the president's prime minister's house. This gate which lead to the president Gotabaya Rajapaksa's residence is blocked post evening, looking at the manner in which the protests have happened at this location. This is the bank of the central bank of Seoul, the Sri Lankan central bank, which has also been the prime center of protests. But one thing is very clear: the Rajpaksas are not going to step down, which is the primary demand of the people, and there have been series of allegations which have been put in against them. We are expecting that there will be a discussion in the parliament, debate in the parliament regarding going to the IMF, which is very important if you talk about the present scenario of Sri Lanka is concerned.
Now, as the debt-ridden Sri Lanka is unable to meet the needs of its own people, protests have rocked the streets of capital Colombo and other parts of the country. About 41 Sri Lankan lawmakers walked out of the ruling coalition, leaving the government of President Gotabaya Rajapaksa in a minority. And despite the ringing echoes of citizens demanding president's resignation over country's worst economic crisis in decades, Rajapaksa refuses to quit. Meanwhile, the healthcare sector is in a grave state with lack of essential drugs across the country. Agitated doctors continue to protest in Colombo, and the Lankan court has barred Central Bank of Sri Lanka's governor from leaving the country. The Colombo Chief Magistrate Court issued the order in response to a case alleging misdeeds during the first tenure between the year 2006 and 2015. The pharmacists in Colombo say that many essential drugs have come from India which were in acute shortage, and the prices have been hiked by the government by nearly 30%. My colleague Priyank, who has been bringing us all the reports from Colombo, has spoken to one such pharmacist from the biggest drugstore in the capital city.
In one of the recent times which has gone slightly worse and out of control from Sri Lankans, the major thing is medicine. We are at one of the most prominent pharmacist shop, which is known as Union Pharmacy, in the heart of the Colombo city, which has been supplying medicines to the people since decades. I'm joined by the person who manages here. Sir, can we know your name, sir?
Ramesh Rodrigo.
Ramesh Rodrigo. Sir, what are the medicines which you think are, you are going to have a shortfall in the few coming days, and which has already been lacking?
At the moment, I can't tell you exactly what is short, but last few months there were some short drugs like paracetamol and some cholesterol drugs, and maybe diabetic drugs, and I heard some cancer medicine also.
Hypertension too.
Hypertension, yeah, all wrong.
So how are we managing the shortage of the supply, Sati, and the price rise could have affected the...
Price rise is about, the government allowed us to increase the price of for the importers about 29%. and it's the price control is still on.
What has been the difference in between the government and private one? Because many medicines are not in the government hospital. We had gone to the national hospital. So how are we managing things, and what is your expectation from the foreign countries like India, which is the nearest neighbor, with respect to the medicines?
They usually now the government was allowed to import Indian drugs on a credit line. So that is given. So we have a facility at the moment.
As you can see, these are the people who have been waiting here for long queues. These are the people who have come here, the attendants of the patient, and they are waiting to get the medicines and most of these, equipment which are essential for the supply of healthcare in the country.